Here on the Crystal Coast lives a sculptor named Antonio. Antonio Carbonell celebrates the beauty of the human form, most often the female form. In fact, he improves upon it. He reproportions it, and when you view his artworks, they're in motion. You see, Antonio Carbonell is a board-certified residency-trained cosmetic and reconstructive surgeon. There are others, but this one is a sculptor. He's right here in Carteret County, your artist in residence.
Hi, I'm Dr. Antonio Carbonell, your body sculptor in residence here in the Crystal Coast. I'm bringing you this series of programs in body sculpting through plastic surgery to help you realize that you don't have to travel far to reach the goals of self-improvement through plastic surgery. In this program, we're going to be discussing the tummy tuck or abdominoplasty. The American Society for Aesthetic Plastic Surgery has been tracking abdominoplasties or tummy tucks since 1997 and has seen an increase of over 500%, which means that over 140,000 procedures are done each year. Now, I've been doing tummy tucks for over 30 years, and my techniques have evolved continuously since the early plaster shells used by the Brazilian Dr. Pitangui. Back then, the patients were kept in the hospital for a whole week, and they were unable to return to work in 4 to 6 weeks. Today, my patients leave the day after surgery walking almost straight, taking minimal pain medication without having to wear cumbersome girdles, feeling amazed that the whole experience was easier than they thought possible while returning to work in less than 3 weeks. There are two types of tummy tucks. The standard tummy tuck that removes skin, stretch marks, and C-section scars and fat from the belly button to the pubic hairline, and leaves a new oval belly button, a tighter abdominal muscle complex, and a curved scar within the bikini line. The second type is the extended tummy tuck, which is done to accommodate those patients that have lost a lot of weight or have many other scars above the belly button from previous surgery. In some cases, the tummy tuck can be done in conjunction with other procedures, such as a breast lift, breast augmentation, liposuction, or immediately following a hysterectomy. As little as 5 years ago, tummy tucks were painful, slow recovery procedures. The patient often accumulated seroma fluid that needed prolonged drainage with up to 4 drains and required a girdle to help walk and move about. Today, with the advent of continuous pain control systems and biocompatible tissue adhesives, patients can look forward to an easier recovery that returns them more quickly to their busy lifestyles. But don't take my word for it. Let's talk to one of our patients who just 2 months ago went through all the latest changes we've been talking about. Hi, Julie.
Hi, Dr. C. I love you. Invest.
That's spontaneous. Thank you for being here with us today. Thank you very much. We've been talking to the folks about this procedure called abdominoplasty. You had it 2 months ago. You had the benefits of all the options that we're talking about. What was it like for you? How did you make a decision to go through with it in the first place?
Well, I have an Italian background and 2 kids, which gives me the pooch that most women get after babies. And the decision to go through with it is I was tired of living in that body. I couldn't wear a bikini anymore. I was wearing larger size clothes.
Your husband has been in Iraq for some time.
Yes, he's been there for 6 months.
Did that play a role in your decision to go through with this?
I think it did. Originally, I wanted him here for his support, but while he was gone, I thought, this would be the perfect time. He could come home and I could surprise him with a new body. I thought that would be fun. I did a lot of research on the internet. I read a lot of stories. I heard the stories about the pain and discomfort for 6 to 8 weeks. That kind of scared me off. I still, even though that scared me off, I still wanted it more than anything. But the doctor had said to make sure that I was done having my children. Mm-hmm. So I went ahead and had my second child, and see the doctor again and have another surgery.
How were you received? What was it like? Did we answer your questions?
Yes, he sure did. I loved you. Oh, you made me feel so comfortable. You hugged me. You let me talk. You made me feel empowered. You let me ask any question I wanted, and I was very comfortable. And I was also comfortable with Lisa, your assistant, who really helped me out a lot also with many questions that I had.
What was it like going to the hospital? Had you been to the hospital before? You had had C-sections?
C-sections, but I was never knocked out.
You never had a general anesthetic?
Never.
Oh, okay. And so, did you have any fears about an anesthetic?
Yeah, I had some fears. I had asked other people who'd been under anesthesia. They just simply said they didn't remember anything when they woke up. But you quickly got rid of my fears for that. And I was fine. I woke up hungry. I had to bribe the nurses for some snacks. So I was feeling pretty darn good, actually.
Did you expect to feel that good when you woke up?
No, I didn't. I didn't know what to expect at all. I thought I would wake up, I could possibly be sick, nauseated. I wasn't sure if I'd know my surroundings and remember hardly anything. But I did. I woke up. I was a little groggy at first, but I made phone calls. I was awake enough to make phone calls, tell everybody I was okay, and then, like I said, I was hungry as usual.
Did you have any pain?
No, none. Mm-mm.
Did you have any pain after you left the hospital?
No, I had no pain from the tummy tuck. It was all lower back pain from being hunched over for a few days. That was it.
And when would you describe yourself as being totally self-sufficient, where you can do just about anything?
Completely self-sufficient. 10 days. That's when I can drive a car, because that's when you're off the medication.
Right.
So 10 days, completely back to normal. I would say 8 days. If I could have been off the medication 8 days, I would have been fine then. But 10 days, I felt as good as new.
Fantastic. I take it you would do it over again
in a heartbeat. I'm coming back to see you next year, or a little bit more.
We certainly have enjoyed having you in our program, and we certainly appreciate your volunteering your thoughts and appreciating all the wonderful stuff that we've done. And we certainly have enjoyed bringing this section to you from plastic surgery. I feel that we have a mission here in Carteret County. We need to bring forward the latest and the best options and procedures. And we want to be able to offer everyone the opportunity not to have to travel elsewhere, to have what they need right here at Carteret County. Until next time, when we have another show on tummy tucks and other things we can do with it, we look forward to seeing you again soon.